break in the video and say, hi, my name is Stephanie Lafazanos. Welcome to our monthly Women's Sexual Energetic Anatomy webinar. And I'm very happy to introduce Martin Beaudoin. Is that how you pronounce your name?
Yep, yeah, it works.
Yeah, and Martin leads what on his Facebook page is called Beaudoin Bodywork. And I'm very excited to interview Martin because I had a pelvic floor bodywork session with him. One of the last times I was in Thailand, and I learned that he was teaching a 100-hour women's pelvic floor bodywork course, which I am so excited to take. And it's happening in November on Vancouver Island in Canada. So lucky for all of us Canadians. I was just listening to a really long message from one of my friends who had taken the course with you, Martin, in just this last month in Berlin. And she couldn't talk enough about how much experience and knowledge that you had around this area of work and study. So very happy to have you here and happy for you to share whatever you feel like sharing with the women who are watching. But why don't we start with, maybe you can just introduce yourself and introduce what it is that you do.
Thank you. Yeah, my name is Martin Beaudoin. I am a pelvic floor specialist in not in the most traditional sense. My training is mostly in body work, trauma work, and I've done training in many different fields. I used to be a professor in speech pathology and linguistics. So the body has always interested me, and psychology. But I've always done body work on the side. And in the last few years, have been concentrating on work with women, especially around the pelvic floor. I did a lot of work on the whole body, so I still do a lot of structural body work. But I've specialized in the pelvic floor because there's very little real help in a lot of issues. For example, pudendal neuralgia is most often not treated. There's also other conditions like any form of prolapsus will lead to surgery typically, whereas we can very often revert a prolapsus with manual work. So I've gone into studying different forms of therapy and different forms of treatment to bring simple technique that can have very deep effect on the body for different forms of pelvic neuralgia, different forms of prolapsus, incontinence, constipation, dyspareunia, vulvodynia is a big issue, and or endometriosis, and there are fairly simple solution for a lot of these issues. Endometriosis is a complex one, but still we've had some success with it with very simple approaches.
Can I interject and just ask you to explain what some of those scientific words mean?
Well,
like some people might not know what vulvodynia are, or the other one that you mentioned.
Dyspareunia. There are different forms of pain, essentially. Vulvodynia is pain, chronic pain in the vulva. Vestibulodynia is chronic pain in the vestibule, so the opening of the vagina. And dyspareunia is pain during or after sex. And it's specific type of pain that can be anywhere in the vulva or the vagina, but it's specifically after intercourse. It can also be after an orgasm or pleasure, sexual pleasure, without even penetration. Even thinking about sex can bring pain in some women. So there's often a very strong sexological or psychological component to it, usually linked to trauma. Not always sexual trauma, but trauma that is stored in the sexual area. So these are some of the terms that we deal with pretty much every day.
Mm-hmm. And how common are they in women?
Oh, way too common. Neuralgia, which is any form of chronic pain, is linked to nerve damage. I see neuralgia in probably half of my clients. And neuralgia is often caused by trauma. So there's no physical damage, but the tension of the muscles or just something in the brain leads to the brain sending a signal of pain in the area. So very often we work physically on the nerve, and I've developed some techniques to reduce significantly or eliminate the pain. But very often it's the trauma work that will get the most impact. So I combine traumatology, de-armoring, and body work together, usually to solve these issues. None of these issues are simple. Essentially, it's like the throat and the mouth. Really, we use the mouth for breathing, for eating, for speaking, for shouting, for blowing on a candle. And it's the same with the genitals. They're used for urinating, they're used for pleasure, they're used for, in terms of for women to give birth, to create birth and to give birth. So they're complex areas. And we know that especially for women, trauma is often stored, even if it's not sexual trauma, it's often stored in the genitals. And through somatic work, we can really relieve a lot of the trauma and thus the pain very often, or the other issues.
Yeah. I just drove by a clinic yesterday. It was in Salmon Arm, obstetrics and gynecology. And I've actually gone into that office before to offer my services because I also, like you, can see that there's a big connection between issues in the physical body and trauma. So can you talk a little bit maybe about maybe the difference between I remember when you were working on me, you were talking a little bit about, gynecologists used to do more manual work, but they do less and less work like that anymore. Can you just talk a little bit to how the medical system is now? I know from seeing pelvic floor physiotherapists that they kind of treat the biomedical aspects of your pain, but they don't necessarily get into the emotional, mental, and all the other stuff. Do you want to talk a little bit to that?
Yeah, the medical field is very organized or very structured, and essentially PFPT or pelvic floor physiotherapists have a very narrow scope of practice. They're not allowed typically to work on the psychological aspect or trauma aspect. And they have to use evidence-based practices, so proven by science. And a lot of the old techniques used in gynecology have never been proven. They were effective, but they've fallen into misuse or unused at this point. Nobody uses these techniques almost. There's a couple of gynecologists in the US, and there's a few researchers in Quebec who are starting to reintroduce those techniques. I use a lot of the old gynecology techniques that you can still find in old treaties. And those techniques still work for the most part. We have new knowledge from neurology that we bring in, and this way we can, and psychology also, traumatology, so we can combine the two. The problem is that everybody in the medical field tries to specialize. And by specializing, we always assume that we're going to be more effective. But really, I think that by missing we're not seeing the tree because of the forest very often. And really, it's an ecosystem. We cannot treat most of physical and matter. Gabor Mate has shown that very, very clearly. We cannot neglect the psychological or emotional aspects when we treat a person's body. We have to. So it's very important. I don't have a scope of practice because as a body worker, my functions are very broad and not specific, really. I cannot claim to heal. I cannot claim I cannot diagnose, but I can work on people and hopefully help them, and usually it works. Really, for people, in my opinion, it's worth trying if there are issues, because the new approach since the beginning, about the 1920s in gynecology has been to use surgery and drugs, really, to solve most issues, or to try to solve most issues. From what I observe, and I have a captive or a narrow population to observe from, but the result is not always the satisfaction by the clients is not always very high, because surgeries bring scar tissue, and scar tissue needs to be removed later. Very often, if they use the mesh or different techniques, they will need a second or a third surgery, and sometimes a fourth. Sometimes surgeries do not work, so we need to do it again, or to give drugs to compensate. And it's a non-ending process. Whereas with bodywork, because we can feel, we can touch, we can assess the result very fast, very often. Within a couple of days, we know if there is an impact or not, in most cases. And we can rework again, and really with palpation, because we develop very acute, very precise palpation skills, we can really get to do a lot of very effective work, I find. It's difficult to assess whether the impact comes from the emotional support, the psychological aspect, or the trauma work that you do, or the physical alone. I think it's the whole thing together, because we're not just molecules and cells. We're also emotional, a big bundle of emotions and ideas and preconceived thoughts. So it is the complexity that makes it work in some ways.
Mm-hmm. I follow some pelvic floor physiotherapists from Ontario. They have a good website, actually. It's called embodia.ca. And she was giving a presentation, and she was talking about the biopsychosocial model and all the evidence in science, especially around pain research, that pain doesn't necessarily come from damaged tissue, that when they do a CAT scan, that they can see the limbic system, the limbic area of the brain, which is actually more emotional, and that the pain is connected to the limbic system and more can be entirely emotional.
Mm-hmm. Yes, absolutely. It's almost every day I have clients that for whom the pain is in most cases somatic or psychosomatic. It's a link between the two. And it's not always because of trauma. It can be, well, it depends how you define trauma, but really it's often because of at least emotions. It's difficult sometimes to cut the boundaries between trauma or strong emotions stored, but in most cases, it's one form or another of trauma.
Mm-hmm.
So,
So talking about emotions makes me think a little bit of Chinetsang, and I know
yeah.
that from chatting with you that Chinetsang is a Chinese abdominal massage that does actually work a lot on the organs and the emotions. It's something that I'm practicing, and I know that you do Chinetsang in your course.
Yeah.
The pelvic floor bodywork course. So maybe we could kind of start to talk about the types of things that you teach, because you said you do about 20% Chinetsang and then about 80% of an integrated Karsai-Netsang.
Yes.
Yeah.
Chinetsang is mostly abdominal. It's really the internal organ therapy, and I take a broad approach in the sense that I also work on the lymphatic system and the breath and the breast, which is not always treated or seen in Chinetsang traditionally. And we cover that in about 20 hours. And the rest of the course is integrative Karzai, which is mostly on genital organs and rectum, the rectum, the anus. We do also a little bit of work. We spend one day on a fascia line that start from the toes and goes essentially through the side of the body, that affects, according to research, about 75% of women. So if you take 3 women out of 4 will have tension on the inside of the calves. For example, a lot of women will have tension in the masseter here. A lot of women clench their teeth at night more than men in what we observe. And that's linked to this fascia line that is especially tight in women.
Okay.
Some men do have it.
Inside of the legs. Inside of
Yes.
the legs? Mm-hmm.
Yeah, it starts under the feet and goes on the inside of the calf, deep inside. If you pinch the deep inside of the calf, a lot of women will feel a lot of sensitivity. Then inside of the calf, pelvic floor, psoas, then the inside of the torso. Then it goes into the neck and the side. So we work on that line for one day. And it is very, very important because a lot of women who have any form of neuralgia in the pelvis will have high tension in that line. So I always start with a Chinetsang, then I work on this line, at least externally, and then I go internally, but I never work, or almost never work, just internally, except if it's purely for trauma work, which is rare because the body, we work on the body as a whole, really.
Do you mind talking a little bit about the Chinetsang, just for people who've maybe never studied it or don't know anything about it?
It's a fascinating set of technique. It's really a set of tools to bring health to the internal organs. Of course, we work on the digestive system, the colon, the small intestine, the sigmoid, colon, all of those. We also work on the liver, on the pancreas that have multiple functions. We work on the kidneys, the spleen, the bladder. Quite a bit of work on the bladder and from outside. We work also on the breath or on the lungs. And I work also on the lymphatic system because it affects the whole body. And it is an internal organ. It's one of the main organs of the body. And I work on the breast as well because it is also an internal organ in the torso. So that's Chinetsang. We work really, it's a very gentle technique. We can even do it just with energy work. Most of the time there is some manipulation, but there is a lot of internal of energy work linked to Chinetsang. Chi means energy. I've often done sessions of Chinetsang with barely any touch, just working with energy, and you can release a lot of elements, a lot of problems. We work also with emotional release. We do a lot of emotional release with and trauma release with Chinetsang. Depending on the need of the person, if the person is not interested in internal work or in general de-armoring process, Chinetsang is a good way to start trauma work.
Mm-hmm.
It's pretty, you often feel results very fast. Yeah. Chinetsang is very simple. We can teach it in 12 to 20 hours. I teach it normally in 20 because I add components. And Chinetsang is very important for pelvic floor because, of course, if you have pressure or tension in the abdomen, it will, or even in the lungs, if your lungs are swollen or if your lungs do not work well, your pelvic floor will suffer from it. One thing that people forget is that the pelvic floor is, of course, a core muscle or a group of muscle that acts as core muscles, but they are primarily a breathing muscle. People do not realize that if the pelvic floor is not synchronized with the diaphragm, and essentially when you breathe in, the diaphragm goes down, well, the organs have to move somewhere, and the pelvic floor has to lower so that the organs go somewhere. The belly will open up, but there is some movement from that goes down. And if the pelvic floor doesn't go down, in men can continue to breathe down. They will develop usually cancers and different severe issues, but women cannot because the uterus is in the middle of the belly, and it cannot sustain pressure from outside very well. And so if the woman has a locked pelvic floor, too much tension, for example, and tries to breathe in through the belly, the breath will stop. That's why we see so many women with shallow breath in the chest. Mm-hmm. I've developed a technique to resynchronize the pelvic floor with the diaphragm, and I've seen an increase in breath by a significant amount. Mm-hmm. We observe it especially with free divers. Mm-hmm. After a session, a female free diver will often increase her performance by quite a bit. I've started to work with free divers for that reason.
This is so awesome. I could use this training, could have used it in the session that I just did because I was doing Chinetsang and I was like, ooh, this person's diaphragm feels really stuck. And then, I'm always kind of connecting to energy and also praying as well. And one of the things that came through was like connect the diaphragm with the pelvic diaphragm and feel the connections and how it's moving together. And so I was also getting my client to breathe and feel how when he inhales, it pushes everything down, and when he exhales, it kind of sucks it back up. But yeah, so this is something that's coming into my awareness more now from doing more Chinetsang. So I'm really looking forward to studying that.
Yeah, you can actually observe the breathing or the impact of breathing on the pelvic floor if you take child's pose in yoga. Yeah. Where you're bent over and your knees are together. The pelvic floor has to open, otherwise you cannot take a belly breath. Yeah. So that's a good way to feel it.
Yeah. And this gentleman, actually, I've been working with him for a while. He has serious pain in his pelvic floor. So he comes to me and he goes to another pelvic floor physiotherapist in Kamloops. And so I've been working with him for a while, and he says sometimes he gets more relief from doing a session with me, but then it comes back. But the thing that he shared with me today that seems to be abating a lot of his pain is that he's taking a pelvic floor yoga course, and he's doing it regularly now, and that's helping him a lot. So it was really good to hear about that. And I know that is also part of your practice and
Yeah.
maybe even part of
Yeah.
the course as well.
Yeah, we always have yoga every morning.
Mm-hmm.
Last time we had a mix of yoga and qigong, which also is interesting in terms of pelvic floor. But typically, I push more yoga because my training is. I have some training in qigong, but I've done more training in yoga, more experience in yoga. But also, is that the nice thing with yoga is that because you have positions like standing, laying, and everything, you can really play with the breath and how the breath is related to the pelvic floor. So we use also yoga a lot for we have usually a day of menstrual yoga and a day of prenatal yoga because there are different aspects of women's health. So the course tried to address most aspect of women's health, except for we don't talk much about pregnancy because in terms of internal body work, you do not want to do internal body work or vaginal body work on a pregnant woman unless you're a trained midwife or a gynecologist, obstetrician. So I do not work with pregnant women. So that's why I do not integrate it. But for other situations, we work a lot with a number of issues. A lot of the work done by pelvic floor physiotherapists is similar to some of my work. The advantage I have is that by integrating yoga, by integrating also energy work, Tantra work, and trauma work, we can combine different forms of therapy. In physiotherapy, we're not really, or they're not really allowed to use pleasure, whereas pleasure is an amazing tool. For example, if one thing that people don't realize is that every time that you have that you build a clitoral orgasm, the ligaments that hold the cervix in place will tense up. And if you combine that with proper breath work, you can literally bring back uterus prolapse to some degree. We've been able to lift a third degree uterus prolapse using essentially a combination of massaging the caudinal ligament, clitoral stimulation, and breath work. And it was totally reversed in one session. I'm starting to work with a gynecologist on that technique because it's super effective. Level 3, normally you prepare for surgery for a hysterectomy or for a mesh, which is on the verge of being forbidden internationally. I'm not against surgeries because sometimes they are essential. And I mean, gynecologists, obstetrician, physiotherapists do amazing work. It's just that we have different scope of practice, and I can combine more easily than they do. I'm of course not as specialized as they are, and I cannot diagnose, but we can usually work on a lot of issues with these simple techniques.
There's something that this is a question that I have because I don't know, something that I wanted to do a little bit more research on myself, but might be just easier to ask you. Like in Canada, do we have any laws, like for me, like I've done sort of yoni healing sessions and types of work that I've been taught in Tantra. Is there any laws around who can massage internally and who can't?
In theory, sex workers can, but not for healing purposes, and PFPTs can. I'm not even sure if gynecologists are still allowed as a whole to do a vaginal massage or a rectal massage, because they do not, from what I've observed, it's not a big chunk of their training, if it is at all. I know that in lots of countries they do not do any massage or manual therapy work anymore, or it's optional in lots of cases. So legally, there's sort of a void. There's a big gap in the laws about Tantra, because Tantra is a very broad field. Tantra can be totally spiritual, esoteric, or can be extremely like purely for sexual purposes. I use a lot of old Tantra, therapeutic Tantra techniques. I use some red Tantra techniques, which are pleasure techniques, mostly to work on energy gates, energy points, because the pleasure spots in women are essentially energy gates. We can use them for trauma work. We can use them for to unlock chakras. We can use them for pleasure. And so different techniques can lead to different results. It's really based on your intention.
Yeah. Can you talk a little bit about the pleasure spots, since you started talking about them? People
Yeah.
Like, oh, what are those spots?
There's it's funny, it's interesting because there's a lot of controversy about the G spot. You read as many people saying that it exists or it doesn't exist. Just come on my table and I'll show you that it exists. It's
no pun intended.
Yes. The thing with all of the pleasure spots is that it's a matter of intention first, because I've worked on the clitoris of some women for emotional release. On one of my clients, for example, I worked for 4 hours nonstop directly on the clitoris, not even around, directly on it, and she never got any bit of pleasure. And it's not that I'm clumsy. It's really a matter of intention. If both the client and the practitioners do not have the intention to induce pleasure and really focus on emotions that arise, you go into the emotional release. And it's the same thing for the pleasure spot. If a researcher is trying to assess the existence of a spot, is not trying to give pleasure to a woman, it's not going to give pleasure. Women are extremely sensitive to emotions. They're emotional machines. They're really, a lot of the work has to involve emotions. You have to be aware of emotions. Otherwise, you're not going to do any, even physical work that is successful. So the pleasure spots there's many pleasure spots. Internally, there are some in the vulva and some in the vagina. If you go from the clitoris, I treat the clitoris as a pleasure spot. Just below that, above the urethra, there's the U spot, which is connected to the communication, one of the communication chakras. It is very sensitive. It rarely leads to an orgasm on its own, but if you combine it with one or two other points, it can lead to amazing pleasure. But I use it mostly to open up communication patterns. If the person is really shut down, doesn't express much, stimulating that point will usually open communication in the person. If you go down just below the opening of the vagina, there's a spot called the PS spot, or perineal sponge. And if you put your finger above and below the opening of the vagina, and you just, with coconut oil, you just create a suction, you'll hear a little bit of noise. You'll stimulate both the U spot and the PS spot. And it is the best way to open the vagina, to open the vagina for work. And it also is provide an amazing pleasure. It also brings a lot of opening in the chakra system. If you go internally, right behind on the upper part of the vagina, right over the behind the bone, essentially, the pubic bone. There's a gap and that's where the G spot is. If you press on it, it might be unpleasant. If you use a lot of coconut oil and you create a suction with 2 fingers or even 1 finger, then you'll get pleasure. One of the problems with a lot of research is that they press, or they use a vibrator which sometimes presses too fast. What you want to do is to create a suction. It doesn't have to be fast. And that will create an amazing pleasure, and it can also lead to female ejaculation, which is not urine, it's liquid. It's lubricant, it doesn't smell like urine. If you go behind that, there's a big sponge. The big spongy area called the female prostate in science now. That's called the A spot in Tantra. It's the anterior fornix. So it's just anterior or above the cervix. And it's a big spongy area. Sometimes the sides of that sponge are very painful or sensitive. There's neuralgia there very often. I'd say about 70% of women have neuralgia on the side, at least to a minimum. But if you stay in the middle and create a suction again, you can get incredible pleasure, some of the best pleasures. And it's very easy to access if the woman is laying down on her belly and opens one leg. Then if you just enter the finger in, you're right on the A spot. And you create a suction or a finger or the penis, and you get an amazing pleasure. But it's all, again, it's not the pressure that will give pleasure, it's suction. And so with men trying to always having a tendency to push the penis in, it doesn't always give pleasure. Instead, if the man enters gently and pull, you get much more powerful pleasure. The cervix itself has a number of pleasure points around. The cervix is sensitive. There's also a point at 1 o'clock that is incredibly powerful, but only older women are open to that point, to my experience. So the cervix has some pleasure points. Behind the cervix is the posterior fornix, or the P spot. That also gives some pleasure, not always a lot, but it's fairly arousing. And if you go down completely at the bottom, beside the anus and on the side of the coccyx, the tip of the coccyx, there is a spot called the K spot, a Kundalini spot. And there lies essentially the place where the Kundalini sits. And a lot of Tantra teachers will tell you that you cannot get orgasms from that. I beg to differ. I've given very, very beautiful orgasm with that. And it opens up the Kundalini like nothing else. It's really like if you're unrolling the Kundalini within seconds. It's incredible, the pleasure that it can give. But also it can open the whole chakra system. If you use it well, you can really open up the whole chakra system. And so all of these spots are linked to different chakras. You can use them for pleasure, but you can also use them for chakra work or for trauma release. Because a lot of these in Tantra, we have different procedures, but when we do the armoring internally, we can work on pain areas to bring awareness on emotions. But working on pleasure spots can also be very powerful at releasing trauma. Some of the deeper traumas can be healed this way. There's also pleasure spots in the rectum, in the anus, around the anus. And there again, it's the technique. It's not only pressing that will give pleasure, it's more often creating a suction that will give pleasure. And there's a lot of release of trauma from the rectum, especially for trauma that happened before at or before 5 years of age. Usually we need to work on the anus or in the rectum.
Interesting. How do you, when a woman comes to you for a session and maybe she has a partner at home, you know, she's in a relationship and she's monogamous, but she's got serious issues that she needs to work through. How do you get to a point where, you know, she could feel comfortable experiencing pleasure by your hand, essentially? Um,
There's different ways, but I don't always use pleasure. We don't necessarily need to use pleasure. Even like when I do trauma sessions, uh, very often women will feel some pleasure here and there, but I'd say that they reach orgasm only if they want to, really, at some point. And orgasm is not the goal in Tantra. Really, I'd say maybe 20% of women on my mat will want to experience orgasm with me. That's not the goal. Very often, women come for gynecological issues, with gynecological issues or emotional issues, and so we work around pleasure. We will use the pleasure sometimes to relax the area, but very often we don't use pleasure at all. If the woman is not open to it, if the intention is not to go into pleasure, they won't feel it. It's really a matter of energy and intentions. But very often also, my preference personally as a therapist is that if the person is in a relationship, I would like to include the partner, the husband, the wife, sometimes even the mother, because I work with women who do not have partners, but they have a sister or a friend who will help. You know, a girlfriend. So I try to involve them, not at the first session, because I need to know the real story, and not all of the real story will come out with if the partner is there for different reasons. So I usually ask them to bring the partner for the second or third session, whenever they're comfortable. And in lots of cases, the partners are not interested. But to me, it gives me an answer very often as to whether the relationship will has other issues. Because if the partner if my partner asks me to go to a therapy session with them, I mean, I will go. Otherwise, I'm not supporting them. But the partner is. Usually I will have a session with both of them. Sometimes the partner just observes. Sometimes the partner is fully participant. Like I did a session today with a couple where I taught the male partner to essentially do some therapy on his girlfriend. Sometimes it's a girlfriend who comes and they will learn on each other or different ways. But I also have a lot of couples who come to see me for pleasure, to see, because they cannot give pleasure to the woman. The man cannot give satisfactory pleasure for the woman. So the woman comes alone the first time, and I explore I do essentially a yoni mapping. And usually in those sessions, the woman decides whether she wants to go into deeper pleasure or not. It's her choice. And it's their choice whether they share it with their partner or not. But essentially, when the partner comes, I essentially discuss with them to see what they do and try to give them tools, but not, I mean, most of the time they're not doing anything wrong. It's just that they might not be targeting the needs of their partner. And every woman is different. Every man is different sexually. So they have to explore, and I help them explore. So I'll very often go through the whole pleasure spots that exist, but also very often I show them how to bring the woman to open up. because a lot of the problems with men is that they're in too much of a hurry. So I calm them down and I slow them down. And they want to be out in an hour. And I say, no, it's going to take 3 hours, at least 2. And we're probably not going to be done after 2-3 hours. It's a complex issue. It's a relational issue. So let's explore slowly. And so I rarely, they're often not doing anything wrong. They're just not doing what that specific woman needs. So I'm just trying to match up their technique with or their intentions with the need of the woman. Or the needs of the woman.
Yeah. I can understand that it gets really complex when within couples, because you've got like each person has their own issues first of all, and then they're bringing their separate issues together.
Yeah.
And then there's the whole skills thing and being able to listen and having the time even to go slowly and learn about each other's bodies.
Also, couples come to me when the women have gynecological issues. It's very difficult for a man to understand the scope of the problem. If, for example, a woman has pain during sex, it gets very frustrating for both partners. And the woman tries, but very often, and goes into very, very heavy pain to be able to sustain a sexual life with her partner. But it's not always possible. And then the man gets frustrated, or the woman, because it's sometimes a woman partner. And it's a complex issue. So I often have a discussion with both, showing actually what the real problem is, and showing the extent and what can be done to help. There are a lot of tricks, a lot of techniques that the partners can use. Sometimes it's products, changing oil, or using cannabis infused coconut oil can help alleviate some of the pain, and you use it as lubricant in moderate amounts, because it is absorbed and gets a very strong buzz sometimes. But there are different ways to go around these issues, and working as a couple is a much more productive way than working the woman trying to work on her own. So it's important to, I always try to include the partner or the partners, because some of my clients have many partners.
Yeah.
So.
And then also, like, I guess, like as a woman who I'm single at the moment, it's nice to know that there could be, a type of practitioner that is there to help with sexually related things, even just like massage. I kind of almost can't believe that this doesn't exist in greater numbers. Like,
Yeah, it is sad.
It's such an important part of our body. It's our creative center. It's such a powerful spot. And as you said, for relationships, it's really important aspect of a relationship for most people to be intimate and to maintain some kind of level of sexual connection for the relationship to even be there.
Yeah, if the woman doesn't feel pleasure through sexual contact with her partner, the libido will go down, and naturally, and depression will usually come after. It is really a fundamental energy, that sexual energy, and the creativity will get lost. So it's very important to maintain the sexual energy by giving pleasure. And really, to me, it starts with self-pleasure. If the woman cannot self-pleasure, it's very difficult for the partner to give pleasure as well. I know that in some religious traditions, self-pleasure is not supported, is not really respected. But really, it's the foundation of self-love. And it is very effective in building self-love. And there are different ways to masturbate or to pleasure yourself, even without the genitals. You don't need, I mean, most of your auditors might not have heard of frictionless sex. But you can actually give incredible pleasure without touching the person. With proper energy work. It is very impressive. Not always easy with everybody. It takes some practice, but it is very powerful. And it really brings the intimacy within a couple at a very deep level if you can integrate energy work with sexual. And for me, Tantra is not about sexuality, it's about intimacy. It's about spirituality, reaching a higher level of spirituality through deepening the intimacy in the relationship. I mean, the technique itself is, well, yeah, maybe I have good technique, but the technique is secondary to being able to relate to the person. If you just do movements, you're just going to create friction. It's not going to give pleasure, really, or higher state of spirituality. So,
yeah, I wonder how many women don't allow themselves to feel pleasure, and then also that seems like it would be really connected to trauma as well. So maybe we can just talk about trauma a little bit, because I'm curious how you feel about this. Trauma is kind of a hot topic, as we mentioned before, and I'm glad that there's so much more emphasis and there's an attention on it, because I think we're starting to realize how much trauma affects so many people. So what percentage of the women that you see would you say some of the issue is trauma-based?
High proportion. A lot of women do not also realize that what they're experiencing is linked to trauma, because people do not always understand what trauma is. But we all experience trauma in our life. Some trauma have deep impact, others have just temporary impact or shallow impact. But really, trauma is essentially any mental state that is affected by past events. And really, it has a heavy impact on the body. Very often, the body will shut down, or there will be different. We know that autoimmune disease are often linked to trauma. Meniere's disease is almost always linked to trauma.
What was that last disease you said?
Meniere's disease, which is a disease of the brain processing of the ear. Essentially, people who have a specific type of vertigo combined with tinnitus, or ringing in the ears. Most cases are linked to trauma. And so trauma is very present. But really, it doesn't mean that all trauma in our life has a big impact, and it doesn't mean that we need therapy for each of our little traumas. You know, the fact that somebody stole your pencil in first grade might have made you cry that moment, but it's not going to have a deep, lasting impact on you, most likely. But some people will. You know, you can have two soldiers who go to the same combat field. One of them will be totally traumatized for the rest of their life, and the other one will be mentally healthy and have no issues with it. It is really, it depends on how the person lives it, experiences it. So it is very different. And it is also much more complex than people think. I have rape victims who actually do not have any or have barely any trace of impact from the rape, but will have a very heavy impact from the fact that their family didn't support them in the following weeks or the following years. It's my case. I was abused sexually, and it's not the abuse as much as the lack of support that has had an impact on me. And so that's where you build the mistrust in people. I've had people being raped, for example, by a certain group or by a man, but are traumatized and have difficulty connecting or trusting women. And really, you can dig for years about why am I traumatized with women when really the source of the trauma is a man. And really, it can be because the mother, or usually it's the mother in that case, but it could be the sister didn't listen or didn't respond, didn't react, so didn't protect them. So, I mean, trauma is complex, and very often we have the impression that the trauma is the most evident thing that comes to mind. This is usually not the big issue. The big issue is usually hidden. And it's by digging a little bit further that we usually find the real issue. And personally, I work a lot with my intuition, and with experience, you come to a point where you can often see the pattern emerging. But for example, if the person doesn't talk about their father or doesn't talk about their mother, or something like that, usually if they don't talk about it, it's because there's an issue, So the absence of sign is a sign on itself, as we say in linguistics, So trauma is complex, but there's many tools now to work on trauma. We can do therapy through discussions, for example, with Gabor Mate's compassionate inquiry techniques. There's TRE, which is a more physical approach, exercise-based in some ways. There's de-armoring, which is basically, in general, most people use pain or discomfort as a source of provoking the trauma. I use either discomfort or mostly pleasure points as a way to work on trauma, but I usually combine it with external sensitive areas of body, like muscle tension will often help if there's muscle tension for example, in the neck. I'll often work internally and work on the neck at the same time. And because there's often some sort of a link I don't always understand. We don't know how it got stored there exactly. There's the polyvagal theory says that it's through the vagal nerve, vagus nerve, which makes a lot of sense. But some elements are not really confirmed. For example, we have people who will experience trauma in the lower body, where the vagus nerve doesn't go. So the theory is not perfect, but there's some strong elements there.
Yeah, that's good to know that that your intuition is strong, and then you've got all this sort of scientific background as well. It feels like you're very well rounded in your approach. And so maybe just to close, is there anything that you want to say about this course that you're going to be teaching? We've talked a lot about some of the stuff that you're going to be teaching in the course, but is there anything that you want to say about the course in November? Maybe just details and things like that, or whatever you feel like.
Yes, we haven't confirmed yet the venue, but it's probably going to be around Duncan, Chemainus, that area. The dates are from the 5th to the 18th, I think, 14 days. There's going to be 2 days off in that within these 2 weeks, 2 non-contiguous days, and there's a lot of material, a lot of anatomy, because essentially, if you understand the anatomy of the pelvic floor, a lot of the issues become very logical. They make a lot of sense. The anatomy, though, that we see is not always what you see in anatomy books, because there are a number of mistakes or things that make absolutely no sense in anatomy books. There's also gaps, nerves that you will see starting in some point and continuing somewhere else, but there are gaps in some of the nerves, and so we see the anatomy in greater details than what you usually see. Some of it is speculative because we cannot observe, we cannot see, but I often work from experience, and also I get the students test it very often, test some elements, and most of the time they all confirm the same observation that I do. So we do a lot of anatomy. We do some massage techniques, but most techniques are pretty simple. There's no need for a background in massage therapy or anything like that. It helps sometimes, but it's not essential. We will study some external body work to some degree, Chinitsang, as we said. Most of the work is intra or around the vagina and the vulva. Some of the work is around the anus and the rectum, because we can access all of the pelvic floor muscles through the rectum. For example, if a woman has an infection or is menstruating and she's not comfortable with working vaginally during her menstruations, we'll simply work through the anus and in the rectum. So we spent 1 full day on the rectum and the anus. We also do one day or half a day on therapeutic Tantra, because it's important to know the pleasure spots. Because first you're going to work in that area. A lot of women have libido issue, and you need to really bring pleasure if you want her to develop pleasure or taste for pleasure. So we do 1 day of Tantra work. All of the participants are women. I'm the only man present, typically, and typically I will demonstrate on the participant. If participants are not do not want me to work on them, it's totally fine. But usually I help quite a bit confirming or fine-tuning the techniques, because very often on one side the student will work on the other side of model. And this way the model can guide the student to get the same sensation. What else? We do a lot of neurological work, nerve work, in the training as well. So that's often interesting for students. We do a lot of nutrition. We talk about nutrition, hormone balance, health, healthy lifestyle, breath work, and yoga, of course, in the morning. We start every day with yoga adapted for the techniques that we see during the day. So it's a very broad course, and it's
I'm so excited to take it.
Usually, also just one last detail, we limit the group to 8 to 10 participants. If there's more than 8, I definitely bring an assistant. I usually like to have an assistant even with 6 to 8. If I can, I bring an assistant. and the assistant is a former student usually. And by the end of the course, everybody should be able to give sessions to at least friends, partners, and solve or help heal or help leading women through the healing path of their gynecological issues or sexual issues in lots of cases.
Mm-hmm. Well, thank you so much for doing this kind of work. I feel like it's absolutely something that we need incredibly, which is why I'm so interested in taking it, because this is an area of women's life that that I want to help empower and educate and help women to be happy. And so,
Yeah.
and where can they find out more about this course? If people want this course.
We haven't advertised very openly yet because of the venue. As soon as we have confirmed the venue, we had one place and it sort of didn't work. So I'm pretty sure we have a second place in or around Duncan. And the best way is to communicate through me through the website, with me through the website. And I'll add them into a messenger group that we form
What's your
for
website?
the training. Beaudoin Bodywork, so BEAUDOIN BODYWORK.com. BeaudoinBodywork.com. They can also find me in Facebook as Martin Beaudoin.
Okay.
Or Beaudoin Bodywork in Facebook as well.
Thank you so much, Martin, for joining us for our monthly webinar and giving us all this amazing information and experience.
Thank you, and thank you for your work.
Thank you.